Great. Dr. Kang, that was so fun. Thank you so much for this interactive session. I hope people at home got the chance to try out those exercises themselves. And as a reminder, Q co-hosts our monthly music therapy group, so please check that out on our website, and you can join her monthly for fun activities like that. And next, as I have on the screen, last but certainly not least, because we want you to come back tomorrow, we have the lovely Maria Schmidt. Dr. Maria Schmidt is a movement disorders nurse practitioner. She specializes in symptom management for people with atypical Parkinsonian disorders and other neurodegenerative conditions. She provides personalized, holistic care that integrates therapies like music-based rehabilitation alongside medications. She practices at the Johns Hopkins Atypical Parkinsonism Center and the Johns Hopkins Center for Music as Medicine. She completed her doctorate in nursing practice at the University of Maryland School of Nursing. She has over 13 years of clinical experience, and she actively advocates for health equity and improved access to care. Maria, I'll hand it over to you.
Great. Hi, and thank you all for having me, and for that great introduction. So basically, the healthcare system can be difficult to navigate, especially when balancing symptom management, disease progression, and I'm here to help just give you some tips to help kind of guide you through it to get you the most comprehensive care possible in a confusing healthcare environment. So these are our objectives today, and what we're going to go through. So what is self-advocacy in healthcare? What can you do? What can you do to empower yourself? And the most important thing to remember is that you are the narrator of your healthcare journey. Self-advocacy represents your own interest within the healthcare decision-making process. It involves you speaking up to communicate your preferences, your concerns, your inquiries, and making informed decisions about your healthcare. But it's also really important for me to point out that this not only applies to advocating for yourself, it's also on behalf of your family member, partner, or loved one. And overall, it's really meant to engage, educate, and empower you. Some of the benefits of self-care advocacy are improved patient-centered comprehensive care, improved quality of life as a result, reduction in symptom burden period, better patient satisfaction, increased patient confidence, improved patient compliance, and there's an overall positive impact on healthcare providers, ending up in better communication and collaboration. One of my favorite quotes is knowledge is power, because it really is. It's, something that you can arm yourself with every appointment. And, in order to do so, you want to come in researching your healthcare condition. And more importantly, too, also your treatment options, insurance, and your pharmacy plans. Just becoming very familiar with those is something that's going to be very helpful. You can request information packets, consider attending an educational course or series. CurePSP has a library of information, and you can look at some answers. That's one of the resources they have, as well as an educational series that they have on YouTube. Another important point to note is that you need to know your rights as a patient. Patient rights in healthcare are essential for ensuring that individuals receive fair, respectable, and appropriate care. While specific rights can vary by country and healthcare system, remember that you should never be denied long-term maintenance rehabilitation services such as physical therapy, occupational therapy, or speech therapy by Medicare, as long as there is a physician certifying ongoing need for services. That is something that you can ask for a letter of medical necessity in order to continue. So that's just one example. Know your privacy laws in healthcare. HIPAA is an example. of privacy laws in healthcare, and they're designed to protect your rights and your personal health information. You want to prepare by coming into an appointment with a binder that can enclose all of the information that you need, some questions, and a medication list and reasons why you're taking them. And you want to also keep a copy of past medications list. So, and why they were stopped. All of this can be really useful in a provider's appointment. And then while you are having your visit with your provider, it's important to take notes, and that way you can write it down a question mark if there's any questions for clarification, and you can also obtain an after visit summary. I don't know if you're the type that likes to get that in printed out version, or if you want to access that online and if that is available, but just in case, you can also have both. It's important to understand, and for the provider in particular, and for you, is that there can be a lot of barriers to self-advocacy in healthcare that can really prevent you from effectively communicating your needs, expressing your concerns, and in participating in decisions about your care. These barriers can be psychological, systemic, cultural, even situational. And addressing them is essential for empowering patients to take an active role in managing your health. And this is really a breakdown of all the different things that both, the provider and the patient need to know, so we can communicate clearly and more effectively. Patient involvement is key and it's necessary. And it's important to remember that shared decision making is a collaborative approach between the provider and the patient, involving care options and the likely benefits and harms of each. And that way you can communicate your preferences and help select the best course of action that fits these. You want to inform the provider about your the language preferences, if you'd like a translator, your religion, and if you're part of a faith-based community that's going to impact some of your wants and needs. You want to inform, of course, the provider and the medical staff about your communication barriers, and that would be asking for a translator. Things like learning difficulties, visual difficulties, reading and hearing. And all of this, once translated, we can help to overcome. You can also prioritize, make sure and ensure you prioritize your questions. That is key. And, this way you can get your concerns and your questions out to the provider. Also, you would like to share your experience. It's important for the provider to understand your journey. Your journey is valuable and your voice is important. Effective communication is really key in this as well. You always want to ask questions and prepare questions ahead of time. You can, write down about 5 or so. I always start with 5, but of course, sometimes they bring up other questions. So you can write them down and bring a notebook or a binder to have all of this information in. There is a great resource on CurePSP's website called A Guide to Preparing for Doctor's Appointments. And there's some really good bulleted points in there that you can use as a checklist so that when you go to the visit, you don't forget anything. Also, you can ask providers to stop and clarify any medical terminology which may be confusing. And ask them, don't be afraid to ask them to go back and clarify. Just say, can you please explain this a little bit further? And this way you get you will have all the information you need. You also want to be honest and transparent about your symptoms, your lifestyle, and your own concerns that you may have. Bring a caregiver with you or a healthcare advocate. You can get you can have, if you do not have a loved one or a spouse, you can actually request a healthcare advocate with you. So you can also, if say you go to your visit and your your healthcare caregiver is not able to make it in person, you can also put them on video or place them on speaker during the visit as well. Really important to feel empowered to speak up if you feel your provider isn't speaking enough to you or to your partner. So if you're a person with PSP, CBS, MSA, and you have difficulty with communication or cognition, the provider may only address you or address the caregiver. And on the opposite end, the care partner's needs are not always directly addressed. So it's really important to make sure that that you're both getting your needs met. For you speak up if you feel your needs, questions, or concerns are dismissed. That's important to ensure that your voice is heard. Also feel empowered to speak up if you need the provider to clarify or give more or even less details on something. And that's the most important point at the end here. You have the right to change providers at any time. Do not worry about providers' egos. This is you. You are important, and this is something that's in your right. I wanted to put together this slide because it's important to activate your interdisciplinary team. You want to start with your PCP and your geriatrician. Usually that's where the referrals come from before, who are notified about something, maybe something is wrong or there's a symptom that, cannot be explained. So, once you're referred and you go to a specialist, you want to make sure that you communicate that diagnosis to your primary care provider and or geriatrician in that case. So it just depends on, what team you have activated to trust in your care. And your provider may not be familiar with your diagnosis. That's why it's really important to bring that Some Answers pamphlet from CurePSP with you, or if you have a binder, or you can ask your provider, your specialist, to send some information over to your PCP so that they know what's going on. And even so, to your social work, for social work, for your caseworker, for your rehabilitation therapy, so they know how to address it even more specifically, as well as for palliative care. It's important for your entire healthcare team to understand your diagnosis and 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 in order to be able to best treat you. So you can also ask your neurologist or movement disorder specialist for referrals to interdisciplinary therapies. So that's really important to have ongoing speech or physical occupational therapies. You can obtain referrals even for social work and counseling, and as well as mental health. So this entire team, it's important to have providers that you feel you can trust and you really vibe with. And it's important, that happens, so that of care. And multiple appointments can be overwhelming. So make sure you ask your provider to help you prioritize them. There can be a laundry list filled with recommendations following a visit. And if you want, and if it's going to help a little bit to allow you to breathe, you can say, please, this is a little too much for me all at once, which will work for me at this time, which may help, because these can be overwhelming. Affordability is really important because you want to become familiar with your types of insurance regarding visits, therapies, medication costs, durable medical equipment, as well as procedures, labs, or imaging. There's so much. And you want to kind of know the gaps in your insurance and ask if there are resources so you can find out how to fill in those gaps. If you are employed, you can consider things like short-term disability or family medical leave. Um, Patients and caregivers can become familiar with the differences in order to know your rights. That's going to also vary by country and by state, obviously. If employed, you can also, become familiar with your sick and safe leave rules. Allow your caregiver to learn about that as well. Ask your provider regarding cost of medications or affordable medications. There are things out there. There are pharmacies out there, Good RX, and medication assistance programs, excuse me, that are available for brand name drugs that will give you a break so that you can make these medications, which could possibly be really effective, affordable for you. Ask questions of the clinic billing department of the outpatient facility, especially if you are uninsured or underinsured. You can get those itemized billing list of prices so that you are not surprised at the end of your visit or when you go to pick up a medication or any equipment. This is what I just went over a little bit, but you also want to make sure that you really want to break it down before the provider sends these medications along to the pharmacies. Ask for options between medications, and know which are more affordable than others. For your resources, you want to know which resources are available to help alleviate the stress of coordination and research, and enlist the help of social work and casework. They truly are the angels in our industry. I will say that every day they really do a world of good for our patients, and it's important to reach out if you need some help. And they're a wealth of knowledge. So there are grants available for you and your caregivers. There's one such grant that comes to mind is a respite care grant through CurePSP, and they're always looking to increase that. They're looking for more people to help. So please take a look at that if you get a chance, and review it. It's not cumbersome even to find out if you're eligible. There are also state and country specific resources for your departments of aging, and state and country specific respite resources on top of this. So you can look, and enlist a social worker, with the Department of Aging to help you out, or even, um, a caseworker if and when you need them. There are adult care centers, which can help out and provide a great environment for your loved one. Um, some other resources, such as clinicaltrials.gov, is important for active and enrolling trials, and you can determine your eligibility and seeing when they are enrolling, and that is live and it's updated constantly. So be sure to keep an eye on that, and you can always bring any questions for any of these trials to your providers for more information. Um, there's advocacy, which is really important for public policy, which can impact your specific illness and really ensure. Um, and finally, you can consider brain donation, and you can ask your local neurologist or explore the brain donation program through a CurePSP. And finally, advanced care planning. What we want to look at when we're looking at advanced care planning, is really considering long-term care insurance, and that's one of the many options that you have. But note, this is a privilege and it can be expensive. Home health aides, this is another option, and sometimes this is mostly out of pocket. So this is why these respite grant programs are really important. Assisted living facilities are around and available. And what's really important about that is, that's also an expensive privilege. And so some of these are, are only available for with the privilege and with extra money. And so a lot of this is making sure you know your options and that there's other things to do that you can use, put it in your pocket as part of your resources. There's also skilled nursing facilities as well as memory care, and advanced directives. I did want to take a little bit of time to talk about this because you can familiarize yourself with advanced directives and know that there are free online tools that, so you can go and you can go through them, and understand them, and then, just kind of get an idea of what you're looking at. And then you can print one of those out and give them to either your PCP. Well, you can give it to all of your providers in your healthcare team. It's really important, but you can review it with your primary care provider or your palliative care specialist. And more often than not, they will walk you through and help you fine tune this really valuable tool. And I think that it's really important to note that you really don't have to pay for it. There are free online tools for you, so you can take them with you everywhere you go, and just keep those extra printouts in your binder that you may have with you. So I did want to let you know about that. A lot of the times you can actually schedule a separate visit with your palliative care specialist if you do have a palliative care specialist, and you can review that with them too. And they can do that step by step. I know I've worked with some palliative care specialists in the past who have done this. So I do want you to know that that is available. And it's important in the beginning to consider doing that, early on, and it may change, and know that you can update this at any time. That's something that's going to be important as well. Um, Also, it's important to know that there is a network of support in your corner. There are so many different places and websites and communities and organizations who are there, and are participating actually in, as centers of care too that are in your area. They are expanding very often, and we're looking for more and more people for knowledge, that will have knowledge of MSA, PSP, and CBS. So you can go. I know there's a great search engine on CurePSP, and if you go, you can put in your zip code and look for the centers of care surrounding your area. There's a document that you can also print out, if you want, and this becomes a really valuable roadmap for you, so that you can not only look through this, and find your first stop for your center of care if you're establishing care for the first time. But if you don't vibe well with this with your provider after your first visit, you can then look up other providers in the area and obtain your second opinion. I always say that second opinions are important, and if a provider is going to be upset with you, I know a lot of patients um, will become up, are scared to talk to their provider, or tell their provider that they'd like a second opinion. But a good provider is going to understand that, because the second opinion is just obtaining more information and more education. And so they should be wanting to help you. And on that note, you can find maybe a local neurologist that could be close to you. If you want to, travel a little bit to the center of care where you found a provider that you really, vibe with and you really are enjoying and trust. And so you can have somebody close to you and then kind of alternate between the two. There are options for you, so that is not as cumbersome with travel, because that can be difficult. Um, so just something to consider. There's a great centers of care resource on CurePSP. Um, look to become involved in events with the community, family conferences, there's webinars and fundraisers. These are ways that, if you're the wants to give back and wants to, be a mentor for another person with the same illness, this is a way to really reach out and help one another. Uh, Um, so there are always updates on many of the websites that are specific to PSP, CBS, and MSA. There's is to know that number one, you are not alone. And two, a lot of these times, like support groups, such as like you can reach out to other patients who have your illness and obtain really good tips of things that maybe you and your provider and your caregiver have not thought of, that maybe have worked out really well um for the other person who is affected. um and I've found that there's been a lot of love and care and tips to give and share. There are support groups. I can't stress these enough. There's some great ones out there, and they're always going on. There's multiple support groups that will happen during the week. On CurePSP, especially, I did want to point out that there are specific support groups for caregivers of patients with PSP, caregivers of patients with MSA. So it's even more specific. And then, of course, for patients who have MSA, patients who have PSP, patients who have CBS, and they have a pretty routine schedule, so you can look. There's actually a calendar of events, and many different websites will have these. The MSA Coalition, I know the Parkinson's Disease Foundation has them. And it makes it very user friendly to just be able to kind of click on the link and click on Zoom and be able to jump on and attend the session. Um, I do want to talk a little bit about bereavement services because these options are so, so important. Even early on, we tend to think of bereavement as an afterthought for resources for patients, but some of these may be state specific, obviously, as well as country specific. But look for counseling that could, if you are the type of person that wants to know, a little bit more about the steps down the road and advanced planning grief, and it's very important for both the patient and for the caregivers. If you ever are interested, they do have these services out there. And if you are, if you do have access to that, or if there is somebody, maybe a counselor or a therapist who specializes in this area, that sometimes will even work on a sliding scale. I do know that not all providers or therapists are able to do this, but some will, and it doesn't hurt to make sure that you ask. The worst that they could say is no. Hospice is also an important thing, and I did want to kind of talk about this even a little bit too, to highlight the difference for you between palliative care and hospice. Um, Palliative care, is symptom management. At least in the state of Maryland, this is going to vary by state and country. At least in the state of Maryland, I do know that your hospice, or excuse me, with palliative care, you can continue your rehabilitation services. So you are able to continue with physical therapy, occupational therapy, and speech therapy while you are doing palliative care. But sometimes when you make that switch to hospice, either you have to go through their therapist, rehabilitation therapist, or they will stop those altogether. So it's something to kind of keep in mind. Palliative care is one of those great resources, like I said, that'll walk you through bereavement services, advanced care planning, complex medical decision making. your advanced directives. They will help alleviate some of that burden off of you. And symptom management outside, the chronic illness that you are experiencing. So it's important to note palliative care should be, there should be a referral for that very early on if you do have that privilege and you do have access to palliative care. I only highlight that because it's not always available in people's areas where, for just according to location and the limitations of travel. So that should be early on, and that could be throughout your chronic illness. Hospice is, that evaluation happens more for end of life care, usually 6 months or less. And there's a list of criteria that they have to go through, and that will also vary by state. So something to keep in mind and be familiar with going down the road to number one, ask about, become familiar with, so that way you take the most advantage of these privileges if and when you are able. I did want to stop and talk a little bit today about some of these really beautiful quotes on self-advocacy that I wanted to share with you. And I don't have them listed here in my PowerPoint, but I did want to let you know a little bit of, profound quotes here. So number one, your body is your temple. And that is important to realize, you are the only one who can truly understand its needs. So that's why it's important to be your own advocate. The best healthcare is the one where you actively participate in your own decisions. Speak up, ask questions whenever and however you are able. When it comes to your health, silence is not an option. Be assertive, be an advocate for the care that you truly deserve. This is your journey. And I said it earlier in my slide, knowledge is power. You always want to educate yourself about your condition first, just like we talked about earlier, so you can confidently advocate for the best treatment plan. Don't be afraid to say no when your health is at stake. You have the right to choose what is best for you. And it's important for legislative and advocacy, speaking up, being a part of policy. If that's something that interests you, some people don't want to do that, and that's okay too. Just know that your voice matters. Don't hesitate to speak up if something doesn't feel right. And I want to piggyback on this because I want to talk about medications and diagnosis. A lot of the times with MSA, PSP, and CBS, it's often misdiagnosed early on. People tend to think people tend not to know a lot about these illnesses, and they will misdiagnose this as Parkinson's. And trust your voice. If you feel like something is wrong, that diagnosis is not right, it's not going to hurt to get that second opinion. It's important. Also, regarding medications, when you start taking a new medication, you've gotten that information up front, you've asked your questions, but then, some of the things that we can't anticipate for medications are side effects. And a lot of the times when you are given a new medication, you like how it's helping your symptoms, but it also brings on these side effects that cause a lot of more problems than it's worth. So don't be afraid to bring up these side effects, for fear of losing that medication. There may be many, many options for you. So I do want to highlight options are going to be your biggest way to advocacy. That puts the ball in your court and gives you that power, to be able to control it. You are in control. And we are there to help back up this journey for you. So I really want to highlight that. Being a self-advocate really is not about being demanding. And I don't want you to feel like you are a demanding person. It's really more about actively participating in your own healthcare journey. So, don't worry about fragile egos. Don't worry about inconveniencing someone. I can't, stress that enough. The right provider will value stewardship and then will value your care. Um, so the most important person in your healthcare team is you. So take ownership of that health and be your own advocate. Um, and sometimes the best way to get the care you need is by speaking up and being empowered. So I do want to take, this time to say thank you to all of you for, listening to me. And I welcome and open the table or open the platform for any questions. These are my references. Thank you all.
Okay. Maria, thank you. That was fantastic. Really appreciate you laying all of that out like that for us. It can be hard to navigate, speaking for myself included, to know if experiences in the healthcare system are normal, even if they make you feel maybe unheard or uncomfortable. And so it's great to hear that we can choose our own healthcare practices, and I really appreciate that. So I'm going to read some questions that we received in the registration and in the chat. And the first one is, do you have anything you would suggest to look out for when seeing a new healthcare professional? And what I mean by that is signs that indicate they're a practitioner that is really looking out for your best interests.
Such a really good question. I will say first and foremost is stewardship. Do they value you in general? Are they taking the time to turn and face you and give you your options? Options are really important. I'm going to highlight that again. Options have been, that puts the ball back in your court so you can figure out, how this impacts you and maybe how it impacts your life and your friends and your family. So I would look at ratings. First and foremost, those are important. So they do say a lot. You can read reviews about a lot of providers. But you will know, and trust your intuition. When you go in, you will have that feeling when you're talking to a provider of whether or not they really are truly valuing you. If they take the time, people that, being rushed is, kind of a red flag number one. It's this type of care, should not have a time limit. I know it's hard we have to get to the next patient. We have to rush. But if they're going to take the time to sit down, and either if they don't have the time at that specific point in time, if they schedule an extra visit to maybe take that time to speak with you, there are providers that will go out of their way for you. And may have that time. So, you will know. I will say that you should trust your intuition. If they're starting to rush, they don't look at you, they barely listen to you, they ask you questions you've already answered, things like that, means they're not listening and they're not valuing your time. I mean, like, everybody makes mistakes, but those are some of the things that come to mind.
Great, that's awesome. We're just experiencing some technical updates. Pardon. All right. Well, Maria, I'll start asking my next question while we get this sorted. So we had someone share an example with us of a positive experience he had. Jack says that he kept a log of the falls his wife had, including the date, just in circumstances of ending up in the emergency room or even just at a general neurologist appointment. That way, when a provider asked how often she was falling, like, he had the data to prove how often she was falling, and that really helped him communicate with the doctor and the provider, and also provided that data. Do you have any similar patient experiences that you could share for others to know that there's tips that they can also do, things like that?
So in general, for patient experiences, like, just keeping a log of everything. I think medications are going to be the most helpful because a lot of the times polypharmacy affects us all, right? And one medication change at a time should be followed, and that way it doesn't really kind of confound or confuse the picture. So maybe writing down the dates and the name of the medication, the dosage, as well as any like side effects that were experienced and if they were discontinued. If you keep that like this log of falls, I think it becomes really, really important. So one, a provider does, kind of skips over that option as a treatment and can move on to the next lot of options that they can leave up to you in order to pick. So that I had a patient who had just had like a really wonderful binder of like a summary of what was going on between their last visit and this visit. I'm not saying you have to do that, but that was like kind of above and beyond, and they sent it to me ahead of time. But it was that was very appreciative because sometimes we can't get to all of the details in it, but we can certainly hit the main points and discuss treating those things. But that's just there are a couple of examples, but I mean, I have so many more that we could talk about.
Yeah, that's awesome. And then this is going back to something you had mentioned in your talk. I'm curious to hear more about healthcare advocates. What's the process like to obtain one? What training do they have? What experience? What could people expect if they obtained one, etc.?
Okay. So first, you always want to look, if you do have a loved one, if you do have somebody like a friend, a family member, a caregiver you can trust. I can't stress that enough. Now, that being said, uh, um, not everybody has that luxury, right? There have been, unfortunately, some instances where I've had patients who do not have anyone for support. And in that case, in order to obtain one, it's very different according to state, right? So but they can do things like you can look and you can do a Google search to find out like a number to get in touch with a caseworker first. And that would be the easiest. So that way they can give you the step-by-step process. But what healthcare advocates do, basically, they help with communicating, right? They help you clearly explain your concerns and needs, and they provide medical history. They take notes for you during the visit. They can record conversations with permission, of course. So that's something you always have to make sure you get. They help share contact information, so that they can give, information to the medical staff. They help arrange meetings, visits, conference calls with your doctor. They help with researching. They research local pharmacies, things like that. So they can check in. The healthcare advocate really can check in regularly with you to make sure you're following up on things. So they're like a really wonderful liaison between yourself and the doctor. And then if you yourself don't feel comfortable speaking up about a specific topic for whatever reason, they can be that person to do that for you. They can even help you with forms. So it's just designating that person as your healthcare advocate. So you start with that Google search, look in your area, because they're going to be probably catchment area, meaning within your zip code or, territory. So you can look them up that way.
Great.
So that's a good way to start. If you need help, you can always reach out to me as well.
That's great.
Mhm.
I think that's going to wrap up our sessions for today. Thank you for this really tangible talk about advocating for yourself within the healthcare system. Really important topic, and I think just empowering even to hear you talking about it, encouraging us. So I thank you so much.